My name's Dan Becker, and I've been doing these prevention chemical substance abuse presentations since 1989. Always in schools, all around central Minnesota. And this right here is part 3 of this program, and each one's been about 20 minutes. And the reason why I'm doing this video now, I haven't done many videos, maybe 3 or 4. I'm doing this because I got a brain tumor and I got a few months left to live. And so I want to do this video so that this presentation gets on video. Now, I haven't done a lot of videos because I feel like it's outdated after you do it. And so I'm going to try and cater to that a little bit, being that some of this stuff is definitely going to be outdated. But here we go with part 3. I had talked about tar and how you can get tumors and cancers from tar. And so, like I said before, an oncology doctor sitting here might say, well, you can't say that, but this is not medical school. This is 7th and 8th graders, and so we got to bring this down to their level. So generally, if you get tumors and cancers, one of these 4 things is most likely going to be involved. You got LDLs, which is low-density lipoproteins, triglycerides, old dead tissue cells, and old dead blood cells. And what do all these things have in common? They're sticky. And so when doctors talk about sticky things being bad for you, a lot of sticky things are bad for you, like cholesterol sticky, trans fats are sticky, fats are sticky, a lot of things that are sticky, and those are sticky. And so like I was just saying in my case, I was around a smoker, and I got a tar ball right here in your lungs. So you get a tar ball in your lungs because you got cilia that helps you to cough things up and spit it out. So even if you did vaporizing, whatever you're vaporizing at this point in time, that's where you can vaporize something. You get things in your lungs because this is what vaporizing lungs would look like, and this is what tar ball lungs would look like. And this is dry tobacco. You got tiny little tar balls, and this is vaporizing, which is like a moisture coagulating of bigger balls, more located. So anyway, you get that, right? Well, when I was 10 years old, I got the croup, and my white blood cell count went up, and I just said that white blood cells, dead white blood cells, would stick to this tar balls right there. Now you're on smoking again, so you got tar on there. Well, now that is a tumor. Now before, we talked about how cells split and double, so you probably want to watch part 2 of this video to find out the way that we talked about cells in your body that are splitting and doubling. So if these cells right here are the kind that split and double, that could be cancerous because they're split and double. Now, to an oncology doctor, again, this is not medical school or oncology school, but to a 7th and 8th grader, we got to have something. And so right now, this is what we got. So if you got something that's much more easier and simplified for a 7th and 8th grader, just throw that in right here. But if you don't, this is what we got. So in areas of your body where cells split and double very fast, like here, you're trying to get rid of things. You got all kinds of areas of your body where cells are split and doubling. Typically, cancer could split and double very fast. In areas of your body where cells split and double very slow, cancer would most likely split and double very slow. And in areas of your body where cells aren't really splitting and doubling at all, doctors call those cysts. They call them lipomas. They call them fatty tumors. So let's say there's a TV show on right now at this point in time when we're making this video that's kind of popular, and it was called Dr. Pimple Popper. Now, I don't know if you've ever heard of it. You might be able to see some reruns on TV. But somebody had a big giant cyst on their arm that she popped it open and bam, all this stuff shot out. So then they always say, well, is it cancerous or is it benign? Is it benign or is it cancerous? They want to know that. Well, to a 7th grader, not, again, medical school, what that really means is, are they splitting and doubling? And so if they take these cells off and they look at them under a microscope, and again, we got to really simplify this. If you got cells that have looked exactly the same, that could mean that they're twins, that maybe they are splitting and doubling. And so they would say, well, it could be cancerous or it's precancer or whatever they're going to say. But it's would be more dangerous if they look a lot more the same. Whereas if you got where they're not splitting them, they might look all completely different. And so again, to a 7th grader, I would appreciate if you want to go ahead and throw some things in there, but that's basically what we've tried to cover with 7th and 8th graders. Since now we've talked about that. Now I want to say something about attention deficit, that in our other 2 previous ones we had talked about stimulant cells, and that is right here. So if you've got the average person, let's say, has this amount of stimulant, whether there be uppers in their brain, somebody with attention deficit, they just got way more than what we have. And so what you do is you give them Adderall or Ritalin or something, because a lot of times in treatment programs, addicts and alcoholics that have attention deficit, they say, when I did meth and crack, that seemed to kind of help me. I drank them energy drinks and it really didn't do nothing for me. I just kind of mellowed down and I say, you're not lying. Because when you put those stimulants up there, these cells, going way back to the first part, part 1 of this video, these cells would say, whoa, we got way too much of something up there because they put a stimulant in their brain. And so then these cells would start shutting down because they're saying we got too much of something. You keep giving it to them and they disappear. And so at this point in time, they're treating attention deficit by giving them exactly what they have too much of already, so that the natural cells in their brain are saying, whoa, we got too much, they're shutting down. And that's how, at this point in time, we are treating attention deficit, is by giving them too much, they have too much of. So let's talk about medications for a second. Very simplified for 7th and 8th graders. Let's say that most people in these treatment programs and so forth, they've heard of gabapentin or Neurontin. They've heard of this medication. But let's say that you know somebody who takes medications for pain, for anxiety, for depression, for anger, for whatever, attention deficit. And let's say that you got a person who takes 400 milligrams of gabapentin, and in their brain it looks like that. So they take it every day as prescribed for 6 months, and then they go into their doctor, and one of three things is going to happen, and it's all based on their response. And the first one, they say to their doctor, I got nothing. I got no change, nothing's improved, nothing's helping with anger or anxiety or depression or whatever. And that tells the doctor that whatever med you're taking, there's no binding going on. And so then we're not going to try that. We're going to take you off of that and try on something else. The second thing that you might say is, well, I got a little bit of improvement, but not a lot. I'm feeling a little bit better. And like, okay, we got the right med but the wrong dose. So we're going to increase that dose. Now the third and last thing that might happen is they say, I feel great, I feel good. You know, whatever it is, this medication I'm taking is feeling good. I'm like, okay, now I got two choices. One, we can leave you on that medication for another 6 months because we want you to live a normal life. We want you to, you know, be a kid in a school and be able to sit still, pay attention in class, and be a good kid. And the other thing is, then we can start to take you off that. No, don't do that. Somebody's got attention deficit. Don't take them off that. They'll be bouncing off the walls. And they say, well, let's try this. We'll drop you down to 300 milligrams with the hope those neurotransmitters pop open and give you 100 milligrams for a total of 400. Now we're going to drop you down to 200 milligrams with the hope these neurotransmitters pop open and give you 200 milligrams for a total of 400. Now we're going to drop you down to 100 milligrams with the hope these neurotransmitters pop open and give you 300 milligrams for a total of 400. Weaning. Best case scenario, that's how your medication is supposed to work. You're supposed to be able to wean yourself off of them, and so that your neurotransmitters pop open because you've been taking these every day as prescribed, and that's what you want. The problems with teenagers, which I worked with, I say, for 30 years, and addicts and alcoholics too, is that they don't do it the way they're supposed to. They go and they take 800 milligrams today, 600 milligrams tomorrow. Then the next day they say, you know what, I don't believe in my medications, they're for crazy people, I'm going to take 0. Then they take 800 milligrams and 600 milligrams. Now if they're drinking energy drinks, same thing, they could get 800 milligrams of caffeine and 600 milligrams and 400 milligrams. Now look at their brain chemistry, are they ever going to get better? Every good day they set themselves up for a bad day, and every bad day they continue the chaos and the confusion of a chemically imbalanced brain. There was a girl come up to me at the ALC school in the hallway, and she says, I got a chemically imbalanced brain. I looked at her and I said, okay. She said, I got a chemically imbalanced brain. I said, why are you telling me that? She said, because you're the chemical. I said, oh, are you asking me what a chemical imbalanced brain is? She said, yes. I said, oh, okay. So I sat her down and explained this to her right here. See, now, if you got attention deficit, the worst thing that you could do is give them uncontrolled stimulants. So if you know kids that got attention deficit, uncontrolled stimulants is the worst thing you could give them, because on days when they don't have any, let's say they're drinking some energy drink or whatever, and on this day, when they go to sleep that night, the brain says, what do we do today and what do we need for tomorrow? That brain doesn't know if they're supposed to be here or here, and those cells can split and double, split and double, split and double, and come back with a vengeance. And now they're in school, and the teachers are like, well, wait a minute, are you taking your medications? You got attention deficit. Are you taking the meds? Because it doesn't seem like they're working. And I'm sitting in this meeting, and what we call it around here is an IEP meeting. It's an individual educational plan. And so we're sitting in this meeting, and I say, no, this is Johnny here. He's not special ed anymore. And like, yeah, Johnny's special ed. I said, no, Johnny's not special ed. They said, well, then what is he? I said, Johnny's energy drink ed. He's, this time I said Red Bull ed, or Rockstar ed, or Monster ed. He's energy drink ed because he's got these uncontrolled stimulants that when he goes to sleep at night, those cells don't know where they're supposed to be. Because what you do is you take them every day as prescribed. Now, somebody who takes medication as a PRN, funny thing is, all the nurses know it means as needed for whatever, but they don't know what the P and the R and the N stands for. But it says, anyway, so what the doctor has figured out for you is that you are living a stable life, and so if something happens, you drop down, you take your PRN, brings it back up, and you keep going. So PRN just means you're mostly stable, and you would need it as needed for whatever that is. And so now that we talked about all that attention deficit, I wanted to throw marijuana into this presentation just because at this point in our history right now, marijuana is incredibly popular around the country, and we got kind of a renaissance going on with it. And so I'm just going to say that in Minnesota, we legalized it back in 2015, July 1st, and all we did was legalize THC and CBD, not all the rest of the stuff, just those two. And for the first couple of years, you had to even have a prescription for CBD. Right now, you can buy that in a gas station, but at this point in time, you did. And so what would be the good use of marijuana at that time? Well, we talked about it helping cataract, glaucoma, pain, nausea, repair, and synapses, seizure, appetite, cancer, Crohn's, and a few other things. And so I'm just going to fly through something right here because this part of this video is going to be outdated pretty soon because there's just so much advancement and things are moving so fast with marijuana. So if you want to fast forward or block this part out or whatever, but we're going to talk about it because this is what we know right now. All right. And so what THC is we talked about that earlier, and that's glue. To a 7th grader, that would be glue. And you're like, well, why is that glue? It's like, well, if it's still positive in your drug test, unless it's synthetic, would burn out a little quicker, but the natural THC, that lasts longer. And so we had, at the time, we thought of 2 cannabinol receptors. We talked about receptors before, where then you get glue on these right here, it causes them to bind together. Now, in my field, the dumbest thing we ever did is we said cannabinol receptors, because there's a lot of kids out there who think that, well, then I'm supposed to have cannabis because I got receptors. Well, those same receptors recept a lot of other stuff too, not only cannabis. But anyway, so you got, we thought we had just 1 and 2 cannabinol receptors, but really there's more. There's 3, 4, and 5, and so on. But so we thought we had 2. And so THC would cause them to snap together and bind, and that's how you get that buzz. Well, what we know about CBD right now is it's a dilator. And so you got these tiny little veins in your eyes, and then boom, it opens them up because it dilates. Now, not quite that big, but it's a dilator. And so how would that help with things like cataract and glaucoma? Now, in my case, if somebody's at high risk for seizures to a 7th grader, you say would be clutter in electronical or the nervous system. So if you got clutter in that system, you might be trying to violently shake to open that up and get that clutter out of there. But if CBD opening things up, that's why, at least at this point, what people are saying, the research that we have is that would be why it might help with seizures. How about nausea? Well, nausea is clutter in the system as well. It doesn't necessarily have to be just in your stomach. When you feel like you want to belch, barf up and puke, you got nauseous, or you could be in an airplane, or whatever that might be. You open things up, you get the flow going, might reduce your risk for nausea. So now this isn't 100% accurate, but this is right now, at this point in time, we're making the video, this is what the science that we're doing. And it could be all wrong, but that's why I hesitate to even do it. But then you got cancer. Now, if I did this presentation, and I do, for a room of 40 kids at an area learning center or kids across this country right now, half of them think that marijuana cures cancer. Cures it. They think it cures cancer. And so the answer to that is if you think of any kid that says marijuana cures cancer, you have to respond to that. You have to respond to that, and you have to say, then why do we have cancer? Like, why does every kid know somebody that died from cancer? If marijuana cured cancer, we wouldn't have cancer. Of course we got cancer right now. We don't have a cure for cancer. If marijuana cured it, we wouldn't have it. So if anything, it causes it. I have a cousin that all he ever did was marijuana. He didn't smoke cigarettes, he didn't drink, he didn't do anything else. All he did was marijuana. And he wound up with emphysema during the final years of his life, and that's what killed him. So drugs in and of themselves don't kill you. It's the side effects like a stroke, a heart attack, seizures, cancers. There's all kinds of things that can happen. And so marijuana does not cure cancer. If anything, he had emphysema, and that's how he died. And so another thing on here would be pain. Well, you've got pathways all over. And I showed you in a previous, what the receptor sites would be and how, well, if you got a pinched nerve, and so you got these pathways and you got cells traveling up and down, they hit the pinch, that hurts. Well, you open things up, you expand that, and so when the cells travel up and down, if that's the size of your pinch, and if it doesn't hit the pinch, it's not going to hurt. So that's why it would help with that, and that could be why it would help with pain. Other than that, marijuana, at least the kind that we have right now, is just a blocker, and so blockers block, which is one reason why doctors don't like to prescribe the current marijuana, because it might be in your system. You can still be positive for marijuana in a week if you did the natural stuff, and during that time, what is it doing? Well, if you use it for its medical benefit in the first 2 to 4 to 8 to 10 to 12 hours, beyond that, it's mostly just blocking. In the Navy, they call it gear drift. You just got stuff blocking around in there. And so they would be blocking, and that's one reason why they don't like to prescribe it, because unless you have other things that get in your body that might not work because you got a blocker blocking them from not working. And it's a downer, it'll slow you down. And so another thing on here, which 2 more things actually, is appetite. Well, that would be the THC, at least at this point in time, appetite. So we got a Taco Bell down there, not too far from this place, and there's all kinds of Stone High School kids going in there on Friday and Saturday. When you get THC into your body the first time, your body really doesn't know what's going on there, doesn't know what to do. But you get it in there another time and another time, the body, wait a minute, we want some substance in here for 5 days or a week or 2 weeks. So we want it to attach to something that we know is leaving. And one thing the body would figure out and is known as a salt or sodium. And so that's why when people get high on the THC part of marijuana, they get the munchies. So it doesn't matter if you got cancer or not. You're still going to get the munchies, whether you got cancer or not. And so it would attach to that. So you see all them Stone High School kids on a Friday night going to that Taco Bell. He's high, she's high, and he's high. They're looking for the Dorito Taco Loco. Like, well, wait a minute, my grandmother, she got cancer. Helps her with her pain, helps her with her appetite, helps her with her nausea. Yeah, it does those things, but now did your grandmother walk in there and order a bottle of vitamin A, vitamin C, vitamin D in a salad? No. She went in there and ordered Dorito Taco Loco too. So she's looking for the same stuff. When people got high on the regular marijuana, the stuff that grows in the ground, and then they get the munchies, did they go into a restaurant and say, "I'd like your finest gourmet salad, please. I love the spinach and load on the peas and the asparagus"? No, they're looking for the Chinese buffet, the greasy burgers, the French fries, the onion rings, and the Doritos. That's what they're looking for, and that's because that's what's loaded up that would cause it to stick to that stuff. And then the last thing on here that we're going to talk about is repairing synapses, which this is as cutting edge as you can get. Now, when you watch this video in the future, they'll be like, that's old news. But so a cell, which could be this part of my hand right here, is a cell, and synapses float around and they're not connected. They're not connected, they just float around. But they give information, nourishment, all kinds of stuff to a cell is what a synapse does. If you got a broken synapse right there, THC could wrap around that and give it a chance to heal. Microscopic surgery can't do that. THC can do something that microscopic surgery cannot do, and that is wrap around the synapse and give it a chance to heal. The bad part is, what if this body's intentionally trying to break that synapse? Because this cell right here might be leukemia. And so by giving it nourishment information, it's going to split and double, and kill you a whole lot quicker. So the last thing doctors want to do is give somebody leukemia, THC. Now, but wait a minute, a kid says, well, you got all these wonderful things. Why don't you tax it, legalize it, and make all kinds of money? We should be doing that. And I said, okay, you want to open up all these veins, open up all these arteries, and fill them with tar balls. You're talking to a guy with a brain tumor from this stuff, and you want me to support you to vaporize and smoke and put this stuff in your body for any reason? No. You're an 80-year-old man, you want to smoke, die, and vaporize and die, go ahead and die. But you're a 14-year-old kid? No way. I don't want no 14-year-old kid going through any of this stuff. I don't go through what I'm going through. Stop the video and let everyone in the room say everything that they know about marijuana, because that's a big topic, and it's going to be, and things that I've said in this video are very well going to be outdated very soon. But I'm not going to be around. So let people in the room talk about everything that they know about marijuana. You got to spend time on that, because that's such a big thing right now, and it's going to be around for quite a while.